So, what are the optimal and safe targets for LDL cholesterol levels for high risk ASCVD patients, and how low can we go? Lowering LDL cholesterol and mortality benefits. Next. Indians have a higher CV risk and experience earlier CV events, and elevated LDL cholesterol levels are crucial due to their strong and linear association with ASCVD risk. Each 1 millimole, 39 milligram per DL decrease in LDL is associated with 21% reduction in major cardiovascular events. Next. And the latest guidelines recommend strike early and strike strong for intensive LDL cholesterol lowering to achieve targets in high risk patients. Lower is better. The 2023 ESC guidelines recommends an LDL reduction to less than 55 milligram per DL in high risk patients and patients with a second CV event within 2 years. An LDL cholesterol level less than 40 milligrams per DL confers additional benefit. And the 2022 ACC Expert Consensus Decision Pathway also recommends clinical ASCVD at very high risk LDL reduction to less than 55 milligram per DL or LDL reduction to greater than 50% from the start. 2023 LAI guidelines. Can we go back to the previous slide? 2023 Lipid Association of India consensus recommends very high CV risk LDL reduction to less than 50, extreme CV risk category A LDL reduction to less than 50, and LDL reduction to 30 less than 30 as optional, extreme CV risk category B to LDL reduction to less than 30, and extreme CV risk category C LDL reduction to 10 to 15 milligrams per DL. So there's no significant association between very low LDL and safety outcomes. A secondary analysis from Fourier trial, which comprised of more than 25,000 patients, showed cardiovascular benefit with further lowering of LDL cholesterol levels with no safety concerns even with LDL below 10 milligrams per DL. So what is the approved indication of inclisiran and where does inclisiran fit into dyslipidemia management? So inclisiran is first-in-class small RNA to lower LDL cholesterol. Inclisiran specifically works in the liver. It mimics the body's process of RNA interference, which is restricted to the cytoplasm, conjugated with GalNAc for specific uptake by hepatocytes. Low likelihood of off-target binding. Inclisiran plasma levels decline within 24 hours and are undetectable within 48 hours. So they prevent production of target protein, greater hepatic uptake of circulating LDL cholesterol, and reduction of LDL cholesterol levels in the body. It's a small interfering RNA acting on the polymerase chain. So inclisiran is approved in India for the following indications. Inclisiran is indicated in adults with primary hypercholesterolemia, either heterozygous familial or non-familial hypercholesterolemia or mixed dyslipidemia. In combination with statin or statin with other lipid-lowering therapies in patients unable to reach LDL cholesterol goals with the maximum tolerated dose of a statin, or alone or in combination with other lipid-lowering therapies who are statin intolerant or for whom a statin is contraindicated. So which kind of patients benefit from this therapy? Next. Inclisiran is useful in high CV risk individuals with atherosclerotic cardiovascular disease whose high LDL levels remain inadequately controlled with standard lipid-lowering therapies such as statins, estimabine, and bempedoic acid. It is also useful in the treatment of heterozygous familial hypercholesterolemia. The recommended dose is 284 milligram of inclisiran administered as a single subcutaneous injection initially, then at 3 months, and then followed by every 6 months. So missed doses. If a planned dose is missed by less than 3 months, Inclisiran should be administered and dosing continued according to the patient's original schedule. If a planned dose is missed by more than 3 months, a new dosing schedule should be started. That is, inclisiran should be administered initially, again at 3 months, followed by every 6 months. Treatment transition from monoclonal antibody PCSK9 inhibitors. Inclisiran can be administered immediately after the last dose of a monoclonal antibody PCSK9 inhibitor. To maintain LDL lowering, previous line. To maintain LDL lowering, it is recommended that inclisiran is administered within 2 weeks after the last dose of a monoclonal antibody PCSK9 inhibitor. Which patients are suitable for inclisiran according to global and national guidelines recommendations? CSI Guidelines 2023, Management of Dyslipidemia and ACS, non-fasting lipid profile within 24 hours. And you have to give 40 milligram of rosuvastatin with estimab or 80 milligram of atorvastatin with estimab. If LDL is less than 55 milligram, maintain it. If the lipid should be repeated at 4 weeks, and if the LDL is more than 55, add PCSK9 inhibitor or inclisiran after high intensity statin, estimab, and bempedoic acid, and then continue lipid monitoring. And next, NICE guidelines recommend inclisiran for ASCVD and heterozygous familial hypercholesterolemia. If recommended statin treatment is contraindicated or not tolerated, follow the regimen. And ACC expert consensus recommends ACVD and heterozygous familial hypercholesterolemia. Next, inclisiran clinical insights, understanding pivotal phase. Next. So you have the phase 3 studies of Orion group, Orion 9, Orion 10, and Orion 11. Orion 9 was for heterozygous familial hypercholesterolemia, Orion 10 for ASCVD, and Orion 11 for ASCVD or ASCVD risk equivalent. And the follow-up was 18 months. Next. And the pooled analysis of Orion trials showed that there was a 50.5% sustained LDL cholesterol reduction, and the between group difference of day 540, there was 50.7 effective LDL cholesterol reduction. Patients Orion inclisiran in Asian patients were studied in the Orion 18, and patients with ASCVD or high risk of ASCVD, and the results showed there was a sustained reduction also in lipoprotein A from baseline 60 to 360 days. From baseline with inclisiran was 57.2% LDL reduction, and LPA to baseline levels was approximately 41% lower than placebo at day 330. Next. Orion 10. Inclisiran reduced levels of other atherogenic lipids and increased HDL cholesterol. Changes in lipid parameters at 5-10 days. Total cholesterol was decreased by 33.6%, ApoB by 44.8%, non-HDL by 47.4%, triglyceride by 14.9%, LPA by 22%, and HDL cholesterol was increased by 7.5%. Inclisiran was generally tolerated well with a safety profile similar to placebo, apart from injection site reactions. Long-term safety data also shows well-tolerated proven safety up to 6.8 years of exposure. And Orion 8, which is an open-label extension trial of Orion 3, of 174 participants assessed long-term efficacy and safety of twice yearly inclisiran in patients with high cardiovascular risk and elevated LDL cholesterol showed inclisiran could reduce LDL cholesterol levels in the long term while being tolerated. And inclisiran acts in the cytoplasm of hepatocytes and not in the nucleus, so there is no risk of carcinogenicity and immunogenicity. Results from Orion 8, the largest long-term safety and efficacy follow-up trial with inclisiran conducted to date, showed inclisiran could reduce LDL cholesterol levels in the long term while being tolerated. So, inclisiran cardiovascular outcome data. The Orion 4 and Victorian 2B are ongoing CVOT trials with completion dates anticipated in 2026 and 2027. While the results of the CVOTs are ongoing, a recently published pooled patient level analysis of Orion 9, 10, and 11 provided more insight into the cardiovascular benefits of inclisiran. There was significant 26% reduction in composite MACE compared to placebo over 18 months and fewer MACE compared with placebo. Mendelian randomization studies with 20 million person years of follow-up proven dose-dependent log linear association between the absolute magnitude of exposure of the vasculature to LDL cholesterol and the risk of ASCVD.